Good to have you with us in the 9 p.m. edition of the Urban Debate. We put the spotlight on all things Omicron, all things new variant that currently the world is talking about. What we know, what we don't know, how should we deal with it? How is it going to affect our life? That's going to be the conversation point. I'm not trying to be alarmist here, but it always bodes well if you have all the information which is available, experts' opinions on how to interpret and analyze that information as you go about preparing for your life. Fact of the matter is, there is still very little known about this new variant of coronavirus. But whatever is known, the fact that it has large number of mutations already indicates that it could be highly transmissible, and that maybe we will have to tweak our vaccines to be able to be effective on this variant. But for us to know this for sure, a lot more data, a lot more research will be required, which is what the world is trying to do right now. Meanwhile, what has been the response? For most of the countries, it has been to step up on surveillance, on testing, genome sequencing, and shutting down borders, or coming up with tougher guidelines. So just as our country was planning to further open up international travel, to start a lot more flights across the country, came the news of this new variant, and now we're looking at a different set of guidelines for international passengers. All international passengers in arriving in India now must submit their travel history for the past 14 days and upload their COVID test reports as well. Now, if you're coming from the rest of the world, you have to submit this history. You have to carry a negative RT-PCR test report. Only asymptomatic passengers will be allowed. And there will also be random testing on arrival, and different states can actually look at stepping that up as well to monitor the health of people, and then subsequently following up on that for the next 14 days. If you're coming from an at-risk country, then the passengers will have to mandatorily also take a COVID test upon arrival. They will have to mandatorily undergo a 7 days home quarantine. If the test report is negative, you will have to do a retest, monitor your health for 7 days, and on the 8th day, take another report. And if your test report comes positive, then of course your sample will be sent for genome sequencing. Top sources in the Ministry of Health and Family Welfare say that so far there are 160 cases that have been detected across the world, none so far in India. Doesn't mean there may not be any case in India, it's just that we haven't found it yet. We haven't done the genome sequencing on it yet. Right now, in most states, governments are looking at the travel history, looking at people who may have come from the South Africa region in the last few days, are tracking them down and getting them tested. The WHO spoke today again. Their technical committee put up a detailed document where they also highlighted what we don't know so far and need to wait to assess. But knowing the available information, the WHO says there is a global risk that they have assessed, and the global risk assessed is very high. That's what the WHO has said. So far, 13 countries have confirmed cases of this new variant. The United Nations agencies are urging countries to ramp up on their vaccination, which should ideally be our big focus as well. The WHO has urged the world to also ensure vaccine equity. The reaction to such developments, new variants, cannot simply be shutting down borders and isolating ourselves or even going into lockdowns, but actually has to be a concerted collective attempt of the entire world to ensure vaccine equity, that even the poor nations get enough vaccines such that their population also gets vaccinated. If only the rich manage to get the first dose, second dose, booster dose, fourth dose, and whatnot, tweak their vaccines to actually move with the changing variants and keep protecting their own people, we will never be able to get a handle on COVID, because the virus will keep mutating and different variants will keep coming out from places where not enough have been vaccinated. Let's talk a lot more about this. I say good evening to Polly Roy, Professor of Virology at London School of Hygiene and Tropical Medicine, Professor Sudhir Krishna, National Centre for Biological Sciences, and a professor at IIT Goa, Dr. Shashank Joshi, Joining me this evening, member of the COVID-19 Task Force in Maharashtra, and Dr. Sanjeev Bagai, Chairman for Nephron Clinics, also joining me this evening. Let me go across to Polly Roy first to get a sense of what you think should be the response of nations at this point, basis what we know about Omicron.
I think that virus is already spread in many places. You know, already we are seeing in Australia and Israel, I'm sure many countries already have it. You cannot stop that spread. However, it doesn't tell us at all that it is a more transmissible or more infectious or cause more disease. It doesn't tell us at all that. It tells us this is circulating. And it's probably started because it started in a small country, small area, and probably someone was immunocompromised, already have chronically infected and make a lot of mutation in the body. And that's one person spread to the other in a country. But then this is a global community that we are dealing with for virus infection. So you cannot stop by stopping the traveling and cannot stop the virus transmission. And virus transmission from one country to another country, not that easy. We have seen for Delta that way. It did not stop at all. We try everything. So I think that is the traveling and all these things is not the point. The point is that we have to be cautious. We have to individually have to be cautious until globally we're all vaccinated. If that you already mentioned that, and I believe very strongly we are in the community, global community, everyone have to be vaccinated. That's the main way, major pathway to stop this virus to change again and again. They will change, but doesn't mean they're more vicious or causing more disease. I don't believe that because there's a limitation for everything. So only way we can say that we have to be cautious initially, and I'm sure we already have many countries. You sequence, you'll find it. But yes, we have to be cautious about it. Okay. Mask and all these isolations and not going in the crowd too much, but doesn't mean we have to be completely stop everything. It's just not possible.
Yes, just not possible to stop everything, and the fact that we swing between the extremes is also problematic, almost going into the second year of COVID. By now, we need to start getting accustomed to a normalized pandemic era life where the mask always stays on. You maintain your distance, and the testing and the surveillance continues to be at a high level. But what do we know so far about this new variant, Dr. Shashank Joshi? I was reading an interview of one of the doctors who's actually treated these patients in South Africa, who said that the symptoms are extremely mild, bringing in a lot of fatigue with it. Now, that's what else can we share with our viewers today?
Tanvi ji, thank you. Dr. Andrea Quetz is the chairwoman of the South Africa Medical Association. We know her personally. In fact, in the Commonwealth Association also she made the same comment. But this is very early days. Remember, the cases she is alluding to are all mild, but normally it is only 10 to 15 days old. If you look at the Gauteng province, you are seeing a threefold increase in the hospitalization rate. We are seeing now that ICUs are gradually filling up, but the ICU admissions have not gone up. 20% increased requirement of oxygen has occurred in the last 10 days. So there are some signals that it could cause mild to moderate disease. That is what it indicates. We have to be patient for the next at least 15 days to 30 days to know the clinical outcomes. Virologically or genomically, this virus looks scary because it has mutations on the spike protein 30+, on the ACE2 receptor 10+, on the cluster of the cleavage site of furin 3+, and even on the nucleocapsid. So every part of the virus, there is a mutation. So it may be more transmissible, it may be more virulent. These are all ifs and buts. Ultimate proof is when a patient gets it, how does the patient behave? Right now, the early indicators from Dr. Andrea's database, and she has a reasonable database, is assuring or reassuring, but it is too premature for us to say that this is a mild variant. I think we have to wait for at least a month to know the true clinical outcomes, because normally, remember, even in COVID, even in the Delta or the original Wuhan strain, we had to wait for 3 to 4 weeks to know the outcomes as far as severe disease and death are concerned. So this week and next week will be crucial for South Africa in those geographies. One thing has happened. In 10 days, the entire delta of South Africa is replaced by Omicron. And that is what has caused the global spotlight. And it has definitely gone out. Now, how those people who have acquired Omicron and also the test positivity rate of South Africa, which was before Omicron, with Delta was 1.6%. That has gone to 9% as of Friday. And today morning, it is around 11%. So if you look at the test positivity rate of the country, it has gone up significantly. If you look at the test positivity rate of that province, Gauteng, so therefore definitely it is more transmissible. And it is a rapidly transmissible virus. That's the only thing which we know in South Africa. So in South Africa, there is community transmission. It is more transmissible. Early data shows that it is definitely causing mild disease and some degree of moderate disease because 20%, 20x times more oxygen is needed, but ICU beds are not required. A large population which has acquired the virus, according to her observations, are that they have not been vaccinated. So probably we need to understand from that database of South Africa, and we must congratulate them. They have excellent clinical database, which is in public domain. They have excellent genomic screening tools, which is again in public domain. And they have been very, very transparent. So as our previous speaker said, that this is one world. We all need to compliment them for their transparency in data, both for genomics and both for clinical outcomes. But I think it is too premature. It definitely is a high-risk strain. And it's definitely a cause of concern because it can replace Delta. Delta was getting extinct, mind you, Tanvi, because in Japan, it got auto-destroyed. Japan is only reporting 100 and 200 cases. So there was auto-destruction of Delta. In Delhi, there is no Delta because auto-destruction of Delta has occurred in Delhi. And there are Delta derivatives. The grandchildren of Delta are there in large parts of India, which doesn't show any COVID right now. And that is why there is a complacency set in the people. Ki abhi to COVID chala gaya. And that attitude needs to stop. So it's a wake-up call for all of us. Double mask, it's an airborne virus. Ensure that air ventilation is maintained and wedding season is round the corner. Please take appropriate precautions and ensure everybody is vaccinated. It is vaccination, ventilation and masking which is the key. But clearly from South Africa, these signals are not good from transmissibility, but from clinical symptomatology, the early signals appear to be mild to moderate.
Okay, so while on the transmissibility part, initial signals are that it could be more transmissible, but it may not be as serious or fatal. That's what we're looking at, but we don't know. We would need a lot more data. I'm going to read out what the WHO has said in as its risk assessment. Given mutations that may confer immune escape potential and possibly transmissibility advantage, the likelihood of potential further spread of Omicron at a global level is high. Depending on these characteristics, there could be future surges of COVID-19 that could have severe consequences depending on a number of factors, including where the surge may take place. The overall global risk related to Omicron is assessed as very high. Now, what could be these various factors? Let's look at that, because what are we interested in? First and foremost, Professor Krishna, is what could be the impact if this virus reaches our country, which inevitably at some point it will, this variant, and what could be the implication for India, basis where we stand today and extent of our vaccination?
Yes, I think the awareness, the complacency which was there before the second wave is not there right now. From a sort of big picture perspective, I think everybody is very aware globally, locally. There's no sense of complacency. So that's a good thing. You can hair split on the specific points of should we do this, should we do that? And I would not do that right now because, as your speakers have pointed out, we don't really know. I think they're correct that this is the first week and time will tell. Nothing I've heard in this conversation so far that strikes me as not on track. I think, so long as you have high self-awareness right now, which we have, we should stay with that. On the point of vaccine equity, I just want to make one point. Vaccine equity cannot be about distribution alone. Vaccine equity has to be about innovation and manufacturing. So unless India, actively partners, this is a global inflection point of two kinds with vaccines. One is vaccine technologies have emerged, which are nucleic acid vaccines, and vaccines like DNA vaccines, in which we're a world leader right now, gives us a tremendous opportunity with both COVID and all the other vaccines to partner with Africa to become a global leader. And so we must absolutely now focus on vaccine equity from an innovation and a manufacturing perspective. May not be something specifically that you had in mind, but since you raised that point, I thought I'd bring it up.
Okay, fair enough. No, I completely agree with you. And I wanted to include that in my intro because a large part of, the WHO's conference today was also about vaccine equity and how there is an urgent need to now address this issue. We'll come back to that in just a bit. But Dr. Sanjeev Bagai, the other big aspect and the debate that's going on is how we are reacting to it in terms of tougher travel curves or shutting down our borders completely to specific countries and the high risk countries which are there. Now, many say that that's not really the appropriate response. But for a country like India, if we allow everybody to come in without testing them or asking questions, then won't it become problematic? With the population our size, surveillance, testing, tracking at every stage becomes very difficult.
Good evening, Neil. So very quickly, I think the entire evolution of the corona variants, when we had the wild strain, then we had the alpha, and then we based our discussion on the wild strain. Then we had the beta and the gamma. We compared it to the alpha. And then we had the delta, which again we compared with the other variants. So at the present moment, the information which we have genomically is very strong. It's a super devil of delta, at least on paper. But at the present moment, it's early days, and I think we need to tread cautiously. We've got very limited data, which is from South Africa, which is coming in. But the surprising thing is a lot of travelers who have not been in South Africa or in Botswana and other such infected countries have reached the European Union and they are testing positive. We also know that apart from the infectiveness and the transmissibility of this new variant, it can also have an immune and a vaccine escape potential, and it can increase the infectivity because it has more than one furin cleavage site. That's what unbinds S1 and S2 part to make it come in. I dare say probably it's already there in India. But with the present vaccination coverage which is going on, reaching 123 crores today, even if the cases are there, they will be very mild. And I still am pretty much sure that the vaccines, even though the vaccine effectiveness may decrease on the ground, but it will hold like the Delta, during the Delta wave, both Covaxin and Covishield held their own. Now, with regards to the travel restrictions, I think it's common sense to screen the travelers with regards to their travel history. It's extremely important. The RT-PCR can have an escape with this variant. So we need to keep a very high vigilance and high index of suspicion, and indeed even screen twice if required. More importantly is we need to check the vaccine status of all the people coming in and out. And our own focus should be the first vaccines should be converted into the second, and the second, as soon as the booster is approved, we come on to the booster. But really, this is the time where we need, through every portal, every channel, every platform, media or scientific, or individual, we need to promote the concept of double masking. We need to promote the aspect that masking can actually prevent the infection ingress and egress almost up to 84% overall. Worldwide studies have shown this. In fact, it's your best vaccine. So travel restrictions, yes. Screening is a must. More amount of genomic testing is extremely important. And I think a huge public awareness now. This is the time of winter. We know that with every 2-degree drop of temperature, there will be many-fold increase of COVID transmission in the air because it is airborne and the pollution transmits it even more. Also, we know that once in the community, it can spread very quickly, especially during the festive time. And this is the marriage season all over India. So I think it's a word of caution. There should not be any panic. Our only focus, only aim, only attention should be on vaccinating as many number of people in the next few weeks as possible. Over to you.
Okay, so you're saying on vaccinating as many people, and we need to step up on that. I think, several governments, state governments, where there are a large number of people who haven't returned for their second dose are already doing that, and they're going about reaching out to those people and pushing them to even take the second dose. That will need to be stepped up. But we're looking at rules and regulations that are being put in place, which say that you get a test done irrespective of the result. You need to be in quarantine if you've traveled and come back from a high-risk nation. Does that help, Dr. Poleroy, to you that question? Even if I'm vaccinated, but I'm returning from a high-risk nation, should I ideally be quarantining myself for some time?
In my view, the vaccine that we have now, all these vaccines will work against this virus, definitely. It not be fully protective, but not cause probably disease so much, but it will still protect very much. You have to understand that a little portion of the spike only are responsible to get into the cell, okay? And that has this RBD, the receptor binding site, is also not completely, only few patches there goes into the cells. It's not that easy for virus to get into the human cells that fast. That's one thing. So vaccine will still work. And I think that while it is important that we have to be cautious, trace and track and isolation, whatever necessary, masking, but I still believe strongly it is essential that we start to think about a little bit more about the vaccine, how we can manufacture the vaccine in each country. That's what is very good idea, actually. And then make sure that people are taking vaccine. But changes that you are talking about in this 32 mutation doesn't matter. The only one I see clearly, there's two changes that alpha and delta had, they share here. And then that one particularly, which is for charged to non-charged residues with cholamine acids, that has some impact. And another one without direct evidence, but I can predict that because the charge change, it may have some effect, but not that much, because their other sites are still active. So mutation somewhere else doesn't matter. This is the first point. Second point is Nobel laureate just published that I was discussing about it, that it is not the spike is the driving seat for the virus changing. It is the nucleocapsid, another protein inside, which takes the genome to make the viable virus. That's the one, the protein is the one in the driving seat to make the changes for everything, because that makes the fit virus or not fit virus. So that protein cannot change too much. So it is not possible to make a completely different virus. The virus will not be then tolerated by itself or by the cells. So they cannot change so much. So change is still going to be limited, cannot be that much change. So I don't believe this is that we have to be panicking about this virus. It's just the same sort of virus, a little bit different. Very slight difference, even in spite of all this gene mutation. They are not necessarily going to impact the virus multiplication in the body. Okay. Definitely not going to impact that. Okay. Impact comes from another part of the virus.
Poleroy, one more question to you before I move on to our other panelists. What about the impact on Europe? Because we right now already looking at a situation in many European nations where cases are on the rise, even though in several other parts of the world they've been pretty much plateaued or on the fall. Europe is actually seeing a significant increase in cases and many countries going into lockdown. At such a time, if this variant spreads, what impact will it have?
So, sorry, but in Europe, not other than the UK, other countries are not highly vaccinated really much.
Right.
Because they have also some other problem than not only the source of the vaccine, but they have, opposition of taking any vaccine. So you cannot stop that sort of mentality, but we have to change slowly discussing about that why vaccine is important. But I think it is more political also, because one country does that, other country has to do that, other country have to do that. So I cannot address that. But they are doing that is that Africa has to be now, no African country can come, but which is, I think, in a way, is very unlucky for them, because they should not have leaked them. They have told us that they have this virus changing, and then we are all boycotting them.
Yeah.
I don't see that how that can help them, So I think we have to think carefully. I'm for sure that UK and other countries will see in a few weeks' time, and then probably the things will change again. So I cannot, as a scientist, I cannot say that it is essential to stop everything.
Okay.
And that,
Right.
we have to process, that's for sure.
Right. In fact, to the point that you made, Dr. Shashank Joshi, help our viewers understand it. Is there a possibility that the virus, the variant may have been detected there but may not have originated there?
So Tanvi, very good question. It's most likely that the virus did not originate in South Africa. And it's most likely that it came from a country which was having lower surveillance system and lower vaccination rate like Botswana. And mostly people think that it is the Botswana patient from where the virus got mutated, probably a chronically infected patient. I don't agree with our previous speaker. On the nucleocapsid gene, there are 3 mutations this virus has which increase infectivity. R203K, G204R. On the NSP deletion is there. There is a cluster of mutations, 3 mutations on S1, S2 furin side. There are mutations on the E, M, NSP, and of course, the whole genome of the virus is affected. So from that standpoint, clearly, that is why there is a red flag. So there are mutations of serious concern on each part of the virus. And that is why there is a red flagging, but the clinical outcome has to be seen. I think the virus has originated probably from another geography, which is why some geographies which have not detected the virus may not have facilities for picking it up. And probably the origin of the virus will be diagnosed and detected better here. We have 4 patients from Botswana which have been seen and probably have moved to South Africa, which is where the spread has occurred quick and fast. Remember, even Delta originated like this. And when Delta originated, almost India was boycotted. We were not able to travel in any part of the world except maybe 2 or 3 countries. So the similar thing has happened with South Africa and Africa, and that is a little sad. But having said that, we have to currently do what is called as, currently it is sporadic as far as rest of the world is concerned. It is in the travel zone as far as rest of the world is concerned. As far as South Africa is concerned, there is community spread. So that is the worrisome concept of it. And clearly you are right that probably this has come from another geography. And all this got accidentally detected because of quarantine. Hong Kong has mandatory 21-day quarantine. So the passenger from who traveled on 22nd of October from Hong Kong to South Africa entered Hong Kong on 11th of November and tested positive on 13th of November. That is the point where the red flagging occurred. And he transmitted it to another person who was staying in the opposite room, and they have a mandatory 21-day quarantine. So many of the countries where there are mandatory quarantines for any person traveling from anywhere in the world, they are the ones who have picked it up. Remember, Hong Kong was the hub of SARS-1, and they have understood the viral clinical management reasonably well. So it is important to recognize that we are in early days. Let us be very clear that we improve global vaccination, and we also ensure that we double mask. We take care of the airborne spread and ensure that we are in free living environment, try to avoid air conditioning environments, try to ensure that we open our windows, have our fans on. If there are air conditioners, try to have exhaust fans or NEPA filters, try to have air purification systems in place, try to have carbon monoxides, because the economic and the educational engine has to continue. But at the same time, we can avoid unavoidable crowds. And I think do not wear cloth masks. If you are having cloth mask, because the virus can get transmitted through a cloth mask, then at least have a 3-ply surgical mask or have an N95 mask. The 3-ply surgical mask is 1 or 2 rupees. So as Dr. Bagai rightfully said, double masking is very crucial. Vaccinating everybody on planet Earth is very important, and ensuring that when we are in indoor environments and which are closely crowded with poor ventilation, we ensure that there is free circulating air which gets circulated all the time. That's the key.
Okay, but what you were saying, Dr. Joshi, about countries who had mandatory quarantine rules, so essentially the ones who managed to pick up on this, I want to ask this question, and maybe Professor Sudhir Krishna can comment on it, because most countries are looking at just the vaccine being enough for them, for people to be allowed in, to move around, to travel around. Will that then be the way forward in the light of newer variants coming out like this?
So can I just finish the point about the nucleoprotein, and then I'll come to this issue?
Sure.
So I think Dr. Poleroy bringing up the nucleoprotein issue is actually a good point, because I think we should actually think about broadening the vaccine structure. So if you look at the current vaccines, there are two categories. They're the spike proteins and they're the subunit proteins. There's the inactivated proteins and then now more recently the subunit proteins. You really want to, particularly now with DNA vaccines, as a possible delivery system, you can broaden that very easily. So you can go beyond the spike. You can actually build in nucleoproteins too. So I think that's one point that I wanted to get across, that it's actually worth investing in rebuilding proteins, and India and Africa can actually be leaders on that front. In terms of the travel issues, I don't have a feel for it, but it's very. I mean, if you look at most people's realistic assessment, travel bans only serve if you have a specific question in mind that you can solve, or a specific implementation or milestone that you put in place. So there's no point in putting a travel ban unless you say, I am going to do the following things in the next 2 weeks or so. And then it's fair enough to put a travel ban. But to put a travel ban without actually specifying what is it that you want to achieve is kind of meaningless, isn't it?
Absolutely.
It doesn't make sense at all. You say I want to put a travel ban, but then define what is it that you're looking for. Otherwise it becomes a very erratic and arbitrary kind of process, and it's not fair. I think it's not fair per se.
Not fair at all, because this is not the right way to do it for virus topic. It just did not happen for Delta. Why we do it again? It's just impact many things very quickly. But yes, trace and track and isolation, masking, all of those things are important to do that. But completely stop and put it in isolation, this test, that test, too much. You have to think very clearly. What is the we can do without disturbing too much, carefully. That's very important. I am very against going in a big gathering even now without the mask, or in a public transport. That's very important, always going to be important for a little while, But stopping everything in a travel ban is just not feasible always.
No, so what I was saying actually, as a concept, what I was trying to understand, Polyroy, and if you are of that view, and then I'll take it back to Professor Sudhir Krishna, that as we open up for more travel and people travel from one country to the other, should the policy be that just your vaccine certificate is enough, because that's what most nations were doing up till now, or that you will mandatorily have to serve a 7-day quarantine period because we don't know, you still may be carrying a deadly variant that we haven't detected so far?
Yeah, but I am vaccinated.
Yes.
I am 3 booster taking already,
right.
Pfizer. I have a very good antibody, but I tested myself, in my lab. So I work on that. So I know that I'm not going to catch anything, for sure. It's not possible. That is scientifically not possible. I know that. It did not change this virus at all. I still wear mask, just as the compiling, whatever they require, I will do that in public. But I know it is not logical for me to wear a mask when I know I have a good antibody. But not everybody knows it. That's why it's a good idea to test, particularly people who already had COVID infection, had the disease. They have a high antibody. Really. We don't have to worry for them so much. But worried is the people who are immunocompromised and then they have no vaccine and they can make a more virus inside slowly, that we don't know. And they may not show any symptom very quickly. And I'm sure a lot of people have this virus already, but have no symptom. I'm sure no symptom.
Correct.
So we don't know that they have it. So I think that at the end of the day, we have to say this vaccine will still work.
Okay.
Indian vaccines and all these vaccines still will going to work, and that mitigate the disease definitely. You have to separate infection versus disease. That's 2 different things. Because that the inflammation is the different things. The different people have different kind of inflammation.
Right. So may I just now take it back to Professor Krishna, and then Dr. Bagai can also give his view on this. Professor Krishna, were you able to finish your point? Did you want to add to it?
So just to respond to what Dr. Polyroy just said, I mean, if you have vaccines, vaccines are one of your criteria, RT-PCRs are another criteria, you have symptoms as the third criteria, I mean, that's all pretty reasonable, okay? I mean, you can't take it to an illogical extreme. It's possible that in spite of that, something might escape, but you've got to have a policy which is reasonable, which allows things to keep going further. And I think, with the kind of testing that people are doing, the kind of vaccine certificates and so on, I mean, that's reasonable. I mean, I don't think, you can just go overboard because,
this is the way it is going, this is the government decision. You can't do anything about it. And I traveled to Germany for 2 days. I have to test 3 times coming back, even though I'm vaccinated. I can't stop that. I have to buy all the things to do it. I have to do it because it's the rules. But sometimes I think it is people not thinking. They're not virologists. They really don't work with viruses. They don't know how viruses work. That's the problem. I'm working for 30 years with the viruses. So I know how viruses work. So I get frustrated sometimes, but what to do?
I can understand the frustration that you're expressing here right now, and I'm sure many others will echo the same. Dr. Bagai, closing comments from you on what should be our policy going forward from where we stand right now.
Yeah, I think a very important point is that when you are checking for international travelers, the first point is that the people must be double vaccinated or at least triple vaccinated, double or triple. That should be the bare minimum. One vaccinated or unvaccinated, I think, should not be allowed to fly. What we are missing out very importantly is that we are not diagnosing. It's impossible to diagnose SARS-CoV-2 with a new variant across the globe. We should use the new formulation of the rapid antigen test, which is the lateral flow RAT, which gives almost a 96 to 97% sensitivity and 98, 99% specificity. This is the global standard for screening. And you screen and pick it up when you are at the infectious most. That means you are highly likely to infect others. So I think we should use the rapid antigen test, the newer versions of it. It gives you a very, very good pickup rate and screen the passengers. I think globally banning countries from all over may not be the only choice and may not be the most appropriate choice. I think the present ban of certain countries and flights coming in is till we get the data and we know how it is reacting clinically maybe. But I think we should use the rapid antigen test alongside with the PCR more judiciously and checking the thermometer, the hand temperatures with these fancy thermometers which rarely work at the airports by people who are practically untrained is like checking blood pressure for an obese patient. It's not going to happen. This is a waste of manpower, waste of time, money, and energy. I think we need to use our resources and thought processes a little bit more rationally. Use the rapid antigen test, screen clinically, and I think over a period of the next few days, I'm quite sure that the travel restrictions would be relaxed.
All right. Let's wait and watch how it proceeds from here. And of course, the biggest one will be to have a lot more information. And once that is out, I will come back to all of you experts to help us understand and then we'll discuss it further. Thank you so much, though, joining me tonight here on this conversation. Repeatedly, the experts are telling us that right now we don't know enough information, but what we know certainly is a little alarming or concerning, and that we need to start pushing and further speeding up our vaccination process and going back to the basics of COVID protocol. Wear your mask, maintain your distance, double mask up every time you step out. Even if you started to go back to your school, college, office, ensure that your mask is constantly on. Because if anything, remember how quickly Delta variant spread, how quickly it went from one to the entire family, and families across cities were in hospitals or isolated, suffering from COVID during the second wave. This variant could be more transmissible than even Delta. Imagine then how quickly it will spread. Our only weapon against it is the mask and the vaccine. For more, we will keep getting you the details and how the policy turns out across the world. Thank you so much for joining us on this conversation.